Hello and welcome to the Kent Northwest Kidney Center April 2022 monthly in-service. It's April 30th and this in-service is a little bit last minute, but I hope the wait was worthwhile. I want to begin by thanking all my sponsors, particularly Dr. Frank Fung, for making this high-quality presentation possible. As all of you know, water is used for the preparation of dialysis fluid or dialysate and is generally derived from either, say, a large municipal water supply or a small community water system or even from a well. Drinking water is not safe for use in hemodialysis applications and must therefore be treated further at its point of use. Now, healthy individuals typically consume about 14 liters of water per week, so about 2 liters of water per day. But in contrast, a typical dialysis patient, say prescribed 3 times weekly dialysis for 4 hours each session with a dialysate flow of 800 milliliters per minute, exposes the patient to much more water, essentially more than 500 liters of water per week across a semi-permeable membrane of the hemodialyzer. Because of the substantially higher exposure to contaminants in water, additional treatments of water are used to prepare the water that's used to make dialysate. Last month, we talked about the process of water purification. This month, we'll talk about the potential contaminants that can sicken a dialysis patient if the process is improperly performed. This talk has 3 objectives. We'll review the signs and symptoms that suggest exposure to water contaminants. We will review potential water contaminants and their clinical presentations. And finally, we'll strive to understand how these contaminants are removed through the water purification process. Let's begin by discussing water contaminants in general. Water used for hemodialysis should comply with the standards developed by the International Standards Organization, or the ISO, and adopted by many national agencies worldwide. These standards define the maximum permissible levels of chemical contaminants and microbial contaminants in dialysis water and make recommendations regarding methods for their quantification. Contaminant exposure can be associated with clinical manifestations that are either acute in onset, so say happen at the time of exposure, or that develop over time with chronic exposure. Acute events related to water contamination generally occur in a cluster of patients while they are on hemodialysis. Although, remember that the severity of these events and their onset during a dialysis session can vary between patients. As an example, exposure to residual disinfectant in the water supply loop predominantly affects patients who are most proximal to the water supply during the first treatment session following disinfection, so like the morning patients. In contrast, chronic exposure to water contaminants is more difficult to identify. So you need to maintain a low threshold for suspecting water contamination when multiple patients are affected while receiving hemodialysis at the same facility. There are many symptoms that we should be aware of that suggest exposure to water contaminants. The problem is that they are very nonspecific symptoms. So for example, pruritus can be seen with lead toxicity or fluoride toxicity. But of course, pruritus is just really common in dialysis patients in general. So if you see pruritus, you wouldn't immediately think, oh wow, wonder if they've been exposed to lead or fluoride. But it's still possible. It's important to recognize that not all pruritus is a consequence of uremia or dry skin. Similarly, nausea and vomiting can be caused by exposure to various metals such as copper or sulfate, fertilizers like nitrates, fluoride, magnesium, arsenic, calcium. But of course, nausea and vomiting are also really common among our dialysis population. Probably the most common reason for it is diabetic gastroparesis. Confusion and dementia most often in our population occurs as a consequence of vascular disease, but can be seen with aluminum or lead toxicity. There's a condition called methemoglobinemia in which patients turn blue, and that can occur as a consequence of exposure to various contaminants such as chlorine dioxide, chloramines, or hydrogen peroxide. Similarly, there are various physical findings that can be seen as a consequence of contamination or exposure to contaminants in the water system. Bone disease can be caused by the accumulation of certain metals in the bone, such as aluminum or fluoride or cadmium, arsenic, mercury, or chromium. Of course, dialysis patients have bad bones anyway because of hyperparathyroidism. Neuropathy can also occur as a consequence of exposure to high levels of lead. But then again, the most common cause of neuropathy among dialysis patients again is diabetes or uremia. Both can cause neuropathy independent of lead exposure. Probably the main laboratory finding that we see in contamination is anemia. So some chemicals can affect the production of red blood cells or lead to their destruction. We call that hemolysis. Exposure to high levels of aluminum or zinc can impact red blood cell production. And hemolysis or destruction of red blood cells can be seen with exposure to chlorine or chloramines or peracetic acid or sodium hypochlorite.
Do you have kidney problems? Have you had trouble urinating lately? Have you been waking up in the night too many times to go pee? Maybe it's time for you to see a kidney doctor. The kidney doctor I recommend is Dr. Frank Fung. He is one of the top 5 kidney doctors in all of East Hill, Kent, and he is also the oldest kidney doctor in all of Kent. Dr. Fung takes really good care of people, and I'm sure he will take really good care of you too. He's very good at tennis and cooks very good hamburgers. He's a very well-rounded person and is perfect for any occasion. So what are you waiting for? Call Dr. Fung today at 425-690-3544.
Okay, now let's discuss contaminants with known toxicity in hemodialysis patients. Let's first talk about aluminum. Aluminum is often used as a chemical additive to the municipal water supply to remove turbidity, particles, pathogens, and other metals from the drinking water during the treatment process. Prior to the widespread use of reverse osmosis in the treatment of water, hemodialysis patients were at risk of chronic exposure to aluminum. Today, aluminum toxicity is rare, but outbreaks do occur, associated with inadequately treated water, particularly if there's failure of the reverse osmosis membrane. Historically, based on the risk of aluminum toxicity among patients on hemodialysis, routine measurements of aluminum were performed, but with improvements in the water purification process, essentially the utility and cost effectiveness of checking levels has really been questioned. I think it's reasonable to monitor levels for patients at risk of exposure to aluminum. So for example, patients who use over-the-counter medications containing aluminum, such as aspirin, or if they're using aluminum-containing binders, such as Amphogel. The chronic exposure to aluminum leads to neurologic injury, bone disease, and anemia. Initial symptoms include altered speech, difficulty articulating words, eventually difficulty speaking. People can develop myoclonic muscle spasms, seizures, and personality changes. Later, they can have global dementia, grimacing, and difficulty swallowing. All of us are frequently exposed to aluminum. get aluminum when you drink the municipal water, if you use cosmetics and antiperspirants, most of which contain aluminum. The aluminum can be absorbed transdermally into our bloodstream. If you cook using aluminum pans, you'll consume some aluminum as a consequence. If you drink sodas in cans, you're drinking aluminum that's in the soda. And finally, if you use certain medications, like antacids commonly contain aluminum hydroxide, or if you use buffered aspirin, all of us are constantly consuming or being exposed to aluminum. Now let's talk about fluoride. So fluoride is added to drinking water in low concentrations to prevent dental caries. But of course it can also be present naturally in groundwater. Overfluoridation of drinking water has occurred, particularly in areas where fluorine occurs naturally. Dialysis patients have limited ability to excrete fluoride and may develop skeletal fluorosis, basically the deposition of fluoride in the bone, which reduces essentially the strength of the bone, predisposing them to fracture. Elevated fluoride levels have been associated with pruritus, chest pain, nausea, and even arrhythmias such as ventricular fibrillation or cardiac arrest. It's unclear if the low levels of fluoride that remain in the dialysate after reverse osmosis contribute to the bone disease, osteomalacia or osteoporosis, that we so commonly see in dialysis patients. Most of the fluoride, however, is removed by the reverse osmosis membrane. All right, let's now talk about the potential for lead toxicity. So lead toxicity can present in many different ways. It can present with abdominal pain or muscle weakness, itchy skin or pruritus, numbness or tingling in the extremities. We call that peripheral neuropathy. And it can also affect your cognition, your ability to focus, pay attention in school, your ability to learn, your personality. There are a couple of potential sources of lead toxicity. One, lead can leach from metal plumbing. So some older buildings, older cities have lead pipes. I'm sure you all are familiar with the story of Flint, Michigan, that several years ago a lot of their kids had elevated lead levels because the city had some old lead pipes that need to be replaced. And high lead levels made it very difficult for the kids to learn, pay attention in school, focus, etc. Historically in the Roman Empire, if you were a wealthy Roman, you got to enjoy wonderful meals that were cooked in lead vessels, and you got to sip on water that had been channeled into your home through lead pipes. And so some historians have argued that lead poisoning might have affected the judgment, the thinking of some of the Roman elite, which could have hastened the empire's fall. So for example, some of the emperors were crazy, like Caligula, and maybe lead toxicity was partly responsible. Lead toxicity can also be present in public water from changes in water treatment practices. So for example, when some cities introduced the use of chlorine derivatives like monochloramine as a disinfectant for drinking water, it led to elevated lead levels in the water because of corrosion of lead piping. Fortunately, lead is removed very efficiently from water by reverse osmosis. Other metals can contaminate the water supply, and these include zinc and copper. Zinc and copper can leach from metal pipes or plumbing into the water, which we then consume or expose our dialysis patients to. Fortunately, zinc and copper can be very efficiently removed from water by the reverse osmosis process. But if there's some problem with the oral membrane and you develop zinc or copper toxicity, you can see complications such as hemolytic anemia, nausea, vomiting, and arrhythmias, including cardiac arrest. Let's talk about hemolytic anemia. Hemolysis is the rupture of red blood cells and the release of contents into the plasma. In the case of copper, it accumulates inside of red blood cells, causing them to break open. With zinc, it causes oxidative injury to the red blood cells, resulting in hemolysis. Enjoy this little video. Nitrates are another potential water contaminant. They're commonly present in fertilizers. They find their way into water sources, and violations in the maximum forcible limit of nitrate for drinking water are pretty common. Nitrates are removed from drinking water by reverse osmosis. Elevated levels of nitrites can cause nausea, vomiting, low blood pressure, and anemia. It can also cause methemoglobinemia. What in the world is that? So hemoglobin is a protein in red blood cells that carries oxygen in the blood. Normally, hemoglobin contains iron in the ferrous state, or Fe2+. But if the iron becomes oxidized to the ferric state, you make something called methemoglobin. Methemoglobin is normally present in the blood, but only in small amount, maybe less than 1% of all the hemoglobin is methemoglobin, and it cannot carry oxygen. If you have an abnormally high elevated concentration of methemoglobin, we call that methemoglobinemia. In this condition, tissues cannot get enough oxygen, and patients become cyanotic or turn blue. So the signs, of course, include discoloration of the skin, so a bluish discolor. Symptoms may include a headache, dizziness, shortness of breath, nausea, difficulty coordinating your muscles. And if it's severe, patients can have seizures, arrhythmias, and die from this. Another potential contaminant of dialysate is something called sulfate. Sulfate comes typically from industrial discharges, but can also occur naturally and can affect many water supplies. Sometimes we actually add sulfate to water in the form of iron sulfate, which is used as something called a flocculant. Flocculation is a process by which a chemical coagulant is added to water, and it acts to facilitate bonding between particles, which creates larger aggregates of particles which are easier to remove from the water once they're all clumped together. It's widely used in water treatment plants. Sulfate levels greater than 200 in dialysis water can cause nausea, vomiting, and metabolic acidosis. Sulfates are removed by the reverse osmosis membrane. The other components of the water treatment system, like the carbon filters, water softeners, and sediment filters, do not remove sulfates. Trace elements are another potential contaminant of dialysate. They enter the water supply from either naturally occurring sources or from industrial discharge. Excess is common in dialysis patients because they accumulate. Typically, they're removed by reverse osmosis. The EPA allows for permitted levels of barium, silver, cadmium, mercury, arsenic, thallium, and vanadium at basically 10% of the value permitted in drinking water. For selenium and chromium, they use something different. They use something called the zero transfer level of SED. That's basically the concentration in the dialysis water at which no transfer by diffusion occurs between the dialysate and fluid. It's slightly higher than the 10% permit. Trace metals can be toxic to bone cells even at low concentrations. And even though the zero transfer level is used for selenium and chromium, increased levels of chromium have often been reported in both the serum and the bone of dialysis patients. Most likely the source of this is dietary intake. Even commonly occurring electrolytes can contaminate water. So these include things like sodium, potassium, calcium, and magnesium. Basically, they're removed during the water treatment prior to its use for dialysis. Recall that calcium and magnesium are usually removed by the water softener prior to the reverse osmosis membrane. Reverse osmosis membrane also removes them, but if you don't remove them by the water softener, you can develop scaling of the membrane, which shortens its lifespan. And the rest are generally removed by reverse osmosis. Now, if the softener dysfunctions, that can lead to not only high calcium magnesium problems, but also hypernatremia, while elevated levels of calcium from failure of reverse osmosis unit can lead to something called hard water syndrome. The clinical symptoms present with nausea, vomiting, weakness, hypertension, and increased risk of arteriovenous fistula thrombosis. Most of you are familiar with chlorines and chloramines and monochloramines. Basically, these are water disinfectants. They remove color from water. They're widely used in pretty much every municipal water supply around the country. But there's some downsides, particularly for dialysis patients. One, they interact with contaminants in the water to form byproducts of disinfection, such as trichloromethane, chloroacetic acids, and chloride, and these are potentially harmful to dialysis patients. They can also corrode copper pipes, leading to an increase of copper level in the water. Same is true also for lead. So chlorine can cause all sorts of problems in dialysis patients, including hemolysis, hyperkalemia, shortness of breath, hypoxia, and cardiac arrest. We discussed hemolysis earlier. Basically, chlorine can damage something called hexose monophosphate in the red cells, and this impairs the cell's capacity to defend themselves against oxidant damage, and that results in hemolysis. Hemolysis, again, is a rupture of red blood cells and their contents into the plasma. Sometimes contaminants to the water system are added by dialysis providers. An example is hydrogen peroxide. It's used to clean storage tanks and distribution systems of dialysis units. Very good for, sterilizing things and killing bacteria. But, of course, you have to flush it through the system and make sure that you get all of the hydrogen peroxide out of the water system before you expose it to patients. Otherwise, it can cause methemoglobinemia. Other chemicals used to disinfect the loop include peracetic acid and sodium hypochlorite. These are added to the water, circulated for a period of time. Sterilant is then flushed from the system using water produced by the water from the treatment system, and then the water is flushed and then tested for the presence of residual sterilant using test strips. But if you don't flush it inadequately, then patients will be exposed to sterilant, and this is particularly of high risk to the first shift patients who are in closest proximity to the water treatment system. If you're exposed to sodium hypochlorite, it can cause hemolysis, hyperkalemia, hypoxia, and cardiac arrest. If you're exposed to peracetic acid, it can cause hemolysis. Both are removed by carbon filtration, but of course, the most important thing is adequately flushing them out of the system. And we for years used peracetic acid, and we definitely had some instances in which it wasn't completely flushed out and patients were exposed. There are also biologic contaminants that can affect the water system. Bacteria and endotoxins can grow in biofilms. Basically, when you get rid of chlorine and all the usual ways to suppress bacterial growth, bacteria can have a field day in the water system if you don't sterilize it properly. And then they can form these slimy layers of biofilm, which are very hard to sterilize, and that constantly exposes the patients to bacteria and bacterial fragments, resulting in a micro-inflammatory response in the dialysis patients, which is believed to contribute to the long-term morbidity among patients on dialysis. We have, sophisticated testing systems that you can use to test for microbes and microbial products, but none of these is actually standardized. The last contaminant I'll mention basically is cyanobacterial toxins. Basically, this is blue-green algae, and a lot of surface water can be contaminated by cyanobacteria, which in turn can produce these chemicals called microcystins. Microcystins can be very toxic to humans. Hemodialysis patients exposed to dialysis water contaminated with cyanotoxins can develop basically fatal reactions. So dialysis units that receive their water that's sourced from warm, slow-moving, nutrient-rich surface water that's prone to algae blooms basically need to be aware that this is a potential contaminant. So in summary, drinking water, which is usually sourced from your municipal water supply, is not safe for a dialysis unit and must therefore be treated further at the point of use. And the International Standards Organization, the ISO, and other agencies have defined maximum permissible contaminant removal that can hopefully prevent clinical problems among dialysis patients. Toxicity from contaminated dialysate water can be acute in onset, say at the time of exposure, or may develop over time with chronic exposure. Basically, you have to have a low threshold for suspecting chronic exposure or toxicity if several patients at the same facility develop similar symptoms. Most contaminants such as aluminum, copper, zinc, fluoride, lead, nitrates, sulfate, and trace elements are removed by reverse osmosis. Some disinfectants such as chlorine or monochloramine or chlorine dioxide can result in hemolysis, hemolytic anemia, methemoglobinemia, and erythropoietin resistance. They can be removed by carbon filtration. Additional disinfectants that we add to sterilize the unit need to be adequately flushed out of the system prior to use. Time for your standard quiz. Question number 1. How are metals such as aluminum, copper, and lead removed in the water preparation process? That's right, reverse osmosis. Fantastic. Question number 2. Name 3 contaminants that can cause a hemolytic anemia or rupture of red blood cells. Survey says chlorine, chloramine, zinc, and copper. Excellent. Next question. Your patient turns blue and you diagnose methemoglobinemia. What are common causes? That's right, chlorine, chloramines, and hydrogen peroxide. Question number 4. This contaminant causes anemia, bone disease, and neurologic problems such as dementia. And the answer is aluminum. Final question. How are chloramines removed during the water purification process? The answer is carbon tanks. Thank you again for your attention, but much more thank you also for the excellent service that you provide our patients. I know how hard you guys work, and you do a wonderful job taking care of our patients, and that's what makes the Kent unit of the Northwest Kidney Center the finest dialysis unit in the Western Hemisphere. Until next month, this is Andy Brokenbrough signing out.